Next month is Heart Month, but you can be a heart hero now when you choose a heart-healthy snack or move your body at the gym. You choose to be your own heart hero, but you don't have to be alone on your journey to heart health. Heart Care is a team effort, and Baptist Medical Network providers are here to join you, like Dr. Sravani Avula. Welcome, welcome.
Thank you.
All right, so heart health seems to be especially important in the new year, right?
Yes, absolutely. Focusing on heart health is very important because cardiovascular disease is one of the leading causes of death in both men and women in the United States and many countries across the globe. Now, that being said, over the past 100 years, we've also come a long way from not knowing about heart disease to now advanced treatments. And also, we are able to identify the risk factors and prevent. Actually, there was a statistical report that was published last year from the American Heart Association, where number of people dying of heart attack in the United States each year has gone from 1 in 2 in 1950s to 1 in 8.5 now. So we made a huge progress, but still not enough.
Right.
So we need to kind of, in order to fight this cardiovascular disease, early detection and prevention is the key.
Okay, and what are the common risk factors of cardiovascular disease?
Well, yeah, so there are many risk factors that we've identified that are associated with the heart disease, but some of the common ones are high blood pressure, cholesterol, diabetes, family history of heart attacks at a younger age, smoking, obesity, and the other one that I would like to mention is women with preeclampsia during pregnancy. Actually, we have seen that they have increased risk of cardiovascular disease in the later part of their life.
Wow, okay. And so at what point should someone see a cardiologist?
Oh, that's a very good question. Now, when they're having symptoms in acute situations, right, then obviously we are involved in the hospital. But in the outpatient setting, there are two components. One is when they're starting to have symptoms like chest discomfort, center of the chest, left side, arm pain, jaw, neck, shoulder blade, and heart symptoms are not these random episodes, they come in a repetitive manner.
So they're consistent.
They're very consistent. If you know it, then you can catch it.
Right.
So they start off initially when someone is very active. And so if you have chest discomfort, it need not be elephant sitting on the chest all the time. It can be a little bit of heartburn kind of a sensation or trouble breathing, huffing and puffing, and heart raising symptoms like a butterfly sensation or passing out spells, near passing out spells. Or when I say anything that is out of ordinary, when in doubt, always reach out to your regular doctor so that way they can send you over to a cardiologist. If somebody has risk factors, right? So then don't wait until the symptoms. We want to catch things early on and maybe even prevent that. So then if we can co-manage those patients as well too, keep those risk factors down. So that way then, we can prevent even somebody having symptoms.
All right, Dr. Avula, thank you so much. Okay, you can enter to win also something too, AirPods. All you have to do is go to the website, baptistmedicalnetwork.com/hearthero, or just scan the QR code on your screen. And to find a cardiologist, just call 210-640-5943 or visit their website, baptistmedicalnetwork.com/heartcare. Doctor, once again, thank you so much.
No, thank you for having me.